Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're introducing another exciting advancement in topical dermatology, Zoryve, a prescription medication that's showing strong results across multiple skin conditions, including plaque psoriasis, seborrheic dermatitis, and atopic dermatitis. Zoryve comes in both cream and foam formulations. And what really sets it apart is that it's steroid-free, designed to be gentle and effective for all skin and hair types. In October 2025, Zoryve earned its latest FDA approval for atopic dermatitis down to 2 years of age, expanding its use to younger children and giving physicians another valuable tool to help manage eczema safely and effectively in the pediatric population. In today's video, we'll focus specifically on the cream formulation of Zoryve and its role in atopic dermatitis. So let's break down the 5 key things every patient, parent, and caregiver should know about Zoryve. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Zoryve and who is for? Zoryve, also known by its generic name Roflumilast, is a prescription topical treatment approved by the FDA for 3 chronic and often challenging skin conditions: plaque psoriasis, seborrheic dermatitis, and atopic dermatitis. The cream formulation comes in several strengths, each tailored for specific age groups and conditions. The 0.3% cream was first approved in July 2022 for plaque psoriasis in adults and adolescents 12 years and older, and its use was later expanded in October 2023 to include children as young as 6 years old. Next came the 0.15% cream, approved in July 2024 for atopic dermatitis in adults and children 6 years and older. Most recently, in October 2025, the 0.05% cream received FDA approval for atopic dermatitis in children aged 2 to 5 years, marking a major step in expanding safe and effective eczema care to younger patients. For completeness, Zoryve foam was approved for seborrheic dermatitis in 2023 and for plaque psoriasis in 2025. Compared to its indication for psoriasis, Zoryve cream, especially the 0.15% and 0.05% strength, is specifically approved for mild to moderate atopic dermatitis, offering a thoughtful balance between efficacy, safety, and tolerability across all ages. Second, how does Zoryve work? Zoryve belongs to a class of medications called phosphodiesterase 4 inhibitors, or PDE4 inhibitors. This pathway plays a crucial role in regulating inflammation within the skin. In many skin diseases, overactive immune signals lead to an excess of inflammatory cytokines, which drive redness, itching, and irritation. PDE4 is an enzyme that breaks down an important messenger molecule inside cells called cyclic adenosine monophosphate, or CAMP. When PDE4 activity is high, CAMP levels drop, allowing inflammation to increase. By inhibiting PDE4, Zoryve helps restore healthy CAMP levels inside immune and skin cells. This rise in CAMP reduces the release of pro-inflammatory mediators across multiple immune pathways, such as Th1 cytokines like interferon gamma and TNF alpha, Th2 cytokines like IL-4, and Th17 cytokines like IL-17 and IL-23. The result is a broad, balanced reduction of skin inflammation. Because the active ingredient, roflumilast, is lipophilic, it penetrates the epidermal lipid layer effectively, delivering its anti-inflammatory action directly where it's needed. In simple terms, Zoryve calms inflammation in the skin, helping to reduce redness, relieve itching, and support barrier restoration over time. Third, let's talk about dosing and application. The recommended use of Zoryve cream is once daily, applied directly to the affected areas of skin. It can be used on most parts of the body, including the face, eyelids, torso, hands, and feet, but should not be applied to mucous membranes such as the eyes or mouth. Patients or caregivers should rub the cream in completely until it's no longer visible on the skin. Afterward, wash your hands unless your hands are the area being treated. If someone else applies Zoryve for you, they should also wash their hands immediately after application. Fourth, let's talk about drug interactions and contraindications. Certain medications that are metabolized through liver enzymes, especially CYP3A4, or a combination of CYP3A4 and CYP1A2, may increase systemic exposure to Zoryve and potentially raise the risk of side effects. In addition, certain oral birth control pills have been shown to increase Roflumilast drug levels, which may lead to a higher risk of side effects. The degree of interaction can vary depending on factors such as how potent the interacting drug is, how much skin is being treated, and how severe the condition is, all of which can influence how much medication enters the bloodstream. If the medications are used together, your doctor will carefully weigh the potential risks against the benefits. Lastly, Zoryve should not be used in patients with moderate to severe liver impairment. Using Zoryve correctly and reviewing your medications and supplements with your healthcare provider helps ensure the best balance between safety and effectiveness. And finally, let's review side effects and safety. Overall, Zoryve has demonstrated a favorable and well-tolerated safety profile across multiple clinical studies in both adults and children. Because it's applied topically, systemic absorption is limited when used as directed. The most common side effects are application site pain, diarrhea, and headache. Other side effects may include nausea, vomiting, trouble sleeping, stuffy or runny nose, red or swollen eyes, or respiratory or urinary tract infections. These occurred at low rates, and the safety profile remained consistent in long-term extension studies. Since Zoryve is steroid-free, it's not associated with skin thinning, folliculitis, or stretch marks, issues often seen with chronic steroid use. This makes Zoryve a particularly valuable option for sensitive areas like the face, eyelids, and skin folds, as well as for long-term maintenance therapy. In clinical trials, discontinuations due to adverse effects were uncommon, and most patients were able to continue treatment. In short, Zoryve offers a reassuring safety profile, helping patients and caregivers maintain healthier, calmer skin over time. And there you have it, 5 essential facts about Zoryve cream, a topical PDE4 inhibitor that's redefining treatment for chronic inflammatory skin diseases. It's approved across multiple age groups, targets inflammation at the cellular level, is applied once daily, and provides effective steroid-free control with a strong safety record. For patients living with atopic dermatitis or plaque psoriasis, Zoryve represents a modern, skin-friendly option that delivers target relief without the trade-offs of long-term steroid use. If you find this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.